Ways we can do this. I'm going to show you what I do. Temporal release, every adult, every baby, I'm doing it just this way. I'm going to do it as a fascial release because this temporal bone is being placed on the head. It's not wedged into this system of other bones interdigitated this way. It's interdigitated this way. Okay? So the squamosal suture is sitting on top of the parietal bone, literally. So where can I grab the temporal bone? Well, you'll see books showing you things, grabbing the arch, grabbing that. To which my answer is, really? You're really doing that? You can't grab under this arch. It's full of tissue and full of all kinds of things. You can draw a book with a picture of a skull and then draw a picture of your fingers pinching around here. You can't actually do it. Okay? So what can I do for this? Well, I can grab his ears like suction cups. And if I pull the fascia out, because this bone is interdigitated in this beveled groove, I can get some release. There's also things we can do intraorally, but we'll do that in the advanced class, not today. So the very simplest, easiest, best thing to do is what I'm going to do here. And I show parents to do this. If you are treating children, one common malady that I'm seeing that you can be very efficacious in treating is chronic otitis media. And if you want a number, I'll tell you about 2/3 of those kids that I'll see who are having recurrent ear infections, not just one. They're having recurrent ear infections and they're going to get myringotomies, tubes in their ears. About 2/3 of those I will be able to solve that problem. 1/3 of them, I'm going to treat them a few times, and the problem, they may get an ear infection again, but they will not get chronic multiple infections during the year that they're thinking of doing surgery. About 1/3 of them, I'm going to be able to fix. Another 1/3, their orientation of the eustachian tube is too abnormal. Before they grow out of it at age 5 or 6, I show the parents something to do at home. And if they do that a little bit, it's a fix until the kid's older. And in another 1/3 of them, I try to do my thing, I show the parents, it doesn't make any difference. If you are doing this on kids who have tubes in their ears, you better tell the parents that the tubes may fall out so that you're not getting a screaming phone call about you made the tubes fall out, because maybe you did make the tubes fall out, but just realize they fall out all the time anyway on their own without you doing anything. Okay, the kids who get tubes in their ears, they don't get them in there once. They get them in, they come out. It's not a stable situation. And in some severe cases, it still doesn't solve the problem for them. Okay? If the pressure isn't balanced from the external tube here, you have an internal eustachian tube, which balances the pressure on the tympanic membrane. And if that, it grows when you're a child, on the inside, outside tube, tympanic membrane, eustachian tube. In a baby, it's more in a lateral position like this, and it grows posterior lateral until about age 5 or 6. If it gets kinked up, what happens is the pressure doesn't balance right, and moisture will accumulate behind it. And moisture, water, a still pond, something will grow there. It won't matter. You're going to treat them. They'll treat the infections. The infections keep coming because there's fluid that keeps accumulating and pressure that's not balanced. And so it's the environment. Certain bugs and things that cause infections in us, they're in our environment all the time. It's a question of creating the right environment for them to grow. Sometimes it's not exposure as much as it is creating the environment. Okay? Sticking your foot in a sweaty shoe and keeping it there for 16 hours a day, and that's your job 5 days a week, you're going to be dealing with athlete's foot most of your life, because that's where it likes to grow, in a nice dark place. Or in babies, very common. You give them might give them a super antibiotic for one infection, then they get a thrush. They get a fungal infection that takes over because the bacteria was keeping the fungus in check. And so a lot of these bugs, all I want to say is that they're in our environmental, and if you create the environment, they grow. So I do this. This is the greatest technique. Adults love it. Kids hate it. If you're treating kids, just do it anyway, because it's going to be good for them. I'm going to grab the inside of his ear. I'm going to do 3 things. I'm going to go lateral. I'm going to rotate my hands this way, and I'm going to go down to the table all together. And I'm going to keep my force constant, so that as I do this, what you'll feel, it's a very strange feeling. What you'll feel once you start to do that pull is you'll feel some tension. After 10 seconds or so, it'll just start to relax, like a muscle relaxed. But there's not a muscle here, it's just the fascia that's around. And usually at that same time where you feel that starting to relax, adults will make a sound like this. Not really. Not really. It's just a happy sound. Okay, adults like it. You play with their ears, whether it's for all kinds of other reasons that I don't want to even guess about. Okay, we like our ears played with. So if you pull on them really hard, no, they don't like that. And if children have an ear infection, this is painful, and I do it to them because this is what's going to help normalize that pressure. Now, as I start to feel that fascia loosen, I will just keep my pressure constant. I'll chase it a little bit, but I'm really not pulling hard. I'm in the middle. This is not grams of force. Those of you who have been told that everything is 5 grams of force, this is a couple of ounces. It's not a pound, but it's a couple of ounces.
What if a client doesn't have pinner or a small pin?
What if?
Client have small pinner or even no pin?
I've had a few patients where it's just been really hard to grip on them, and you can do it another way.
On temporal?
Yep.
Okay.
Now it's starting to come. For chronic ear infections with children, I will show the parent how to do this one technique, and I tell them to do it when the kid is sleeping. Because if they're gentle, they probably won't wake the kid up, even if they're sensitive. I say do it for about 30 seconds every day, once or twice a day. And that will keep this in check until they're old enough. For those kids where they need to, their orientation is the problem. So I will show the parent how to do it, and I'll put the parent on the table, and I'll have them feel it, and then I'll have them do it to me. Okay? If you're going to have them do something at home, they got to do it to you, you got to do it to them. If you can't, another way to do it, I just don't like doing this, because people don't like it. I call it a wet willy. When you were a kid, who has siblings in here, brothers, sisters? Okay. Which one of you, did you ever have your brothers or sisters or something lick their finger and then stick it in your ear? Well, then you had nice brothers and sisters, okay? Did you do this to him when he was little? No? You're not willing to admit it here? Yeah, my sister used to beat the hell out of me and torture me, so I got the wet willy. I got tickled till I couldn't breathe. I got all of it, okay? Yeah, I never got even either. Too tough. So you can stick your fingers just right in your ears, and some people, this is just a weird feeling for them. I'm not putting a lot of pressure on him. I'm just going to rotate like a wheel, the same way we did torsion. Okay, go in opposite directions one way. You're not massaging going back and forth. Okay, you need to keep some pressure here. You cannot have fingernails. If you have fingernails, better known as spikes, okay, then this technique you're not going to do. And you'll get a nice release. You do it one way, do it the other way. You have to maintain medial pressure. Otherwise, you're just sliding along an area that's already got its own grease being secreted from the canal. So it's a little more difficult. It's a fine way to get a fascial release around the temporal bone, because the fascia is helping to cement this bone. The next way to do it, I want to show you when we do the balancing. There's a third way to do it, which is also very nice. Do you want to describe anything?
Well, actually, I didn't feel any particularly.
Okay. If they have a hearing aid, it's coming out while you're doing that. If they have some device that's not coming out, you do what you can. And for me, I like to do this when I show the parents. You're going to sit up. If it's a parent for a child, I show them because they're afraid that they're going to pull the kid's ears off or they're going to hurt them. So I say, lay down. I show them how to do it, and then I have them do it to me. And I will have Paul. Paul's going to do it to me. Now he's the parent, right? I just showed him how to do it. So you grab my ears and you pull. I do that to every single parent. I'm not joking with you at all. I do it to every single parent because they're so worried that they're going to do something to hurt the kid. So I've done it to the kid. The babies are crying the whole time I'm working on it. It's not a happy, they got an earache, I'm doing it, they're crying. It's just like applying medicine. They need it. And then so I show the adult, and the adult likes it. They're like, oh, this is nice. And I say, do it to me, and I said, look, you're not going to kill the kid. You're doing it fine. And then I put my hands on their hands. Sometimes you have to break it up a little bit, the seriousness of it. I've had many adults ask me this one question from me doing this treatment on the ears. What's the one question you think they might ask me?
How long do I do it?
No,
Does it hurt?
you're not a parent, huh?
Does it hurt?
No.
The year would be good enough.
Say it?
The year would be 25.
That's exactly it. Do you have kids?
I don't know. No.
Do you want kids? I got to look for it. You drive me crazy. I've had so many parents ask me, will this make their ears stand out? As if me pulling on this for 30 seconds can alter somebody's physiology so that they're going to look like Will Smith or something. It's a very common question, yeah.
Well, if I,